Hi.
Hi Rajat,
Hi.
how are you?
Hi. Good. Thanks. It's been lovely meeting you guys. So finally, we are doing this session where we can help our juniors who are willing to come to Australia and US. So let's start. So my first question is, if somebody wants to come to US as a doctor, how do they start? Is the basic question for everyone.
To come to the US, you need to apply for residency. You cannot practice in US without doing residency in US. And to go for residency, you need your USMLE exams, you need rotations, and you need research. And then you apply for residency, which is a 1 year long process. And once you match into residency, you can train and then practice. So to start, you would need to start with the USMLE Step 1 exam.
How many steps are there until you start practicing there as a doctor in US?
In exams, we have 3 steps, that is USMLE Step 1, 2, and 3. And to apply for residency, you only need the first 2 steps. The third step is optional. You can even take the third step during your first year of residency. But there are 3 steps, and all these exams, like the first 2 steps, are 8 and 9 hour long exams, where you 280 to 320 questions. Each question is case based, and yes, that is how the exams are.
These are the MCQ exams, right?
Yes, all of these.
And you can take both these exams from India.
Yes.
Okay, so for Australia, we have 2 exams. First is MCQ exam. There are 150 questions, and it's not very difficult exam. And if somebody wants to prepare for Australia, they just have to go. There's not many coachings, and it doesn't even need coaching for that. So you can get Amadex. There are some questions and recalls, and you can easily crack in like 3 or 6 months of preparation. And then you can apply for jobs. And 10 AMC too, if you want to do before getting a job, that's good thing, because getting a job will be easier. Otherwise, you can start and meanwhile go for AMC2 or WBA. So for Australia, the timeline is like once you start preparing from step 1, it usually takes 1 to 2 years. So if year is minimum, and then up to 2 years, almost many people get their first job during this time frame. What about US?
So in US, it is usually like you need 1 year for the exams. That is, you take the step 1, step 2, you also do your rotations. So all of that takes a minimum of 1 year. And then the application process itself is 1 year. So it takes 2 years.
But then 1 year is also a very rushed timeline. Usually it takes people about 2 years to fully complete their rotations and steps and everything. So, but you can do it in 1 year, but that'd be a very rushed and very close timeline.
Right.
When I was preparing for, I was thinking of USMLE. I had this idea in my mind, like it will take minimum 3 years till I move to 3 to 3.5, because I've seen people struggling to get their, that matching thing, and then it's a very long procedure.
Yes.
Is it true?
Yes, it is long, and matching is also kind of like difficult, and also like it can take. I wanted to ask you about AMC. So what I've heard from my friends is that AMC 1 is, as you said, it is relatively easy, but AMC 2 is very difficult. It has a pass rate of less than 50% or...
No, the passing rate for AMC2 is 22% last year.
Oh, wow.
So it's difficult, but in terms like not for the clinical knowledge, it's how you communicate with the patient. Because in India, what we practice is totally different. In this AMC2, there are 16 to 18 stations, and you have to, there's like, earlier it used to be like online. So we have a Zoom meeting, so something like that. There is a actor in front of you. So
right.
You'll have a situation like there is this patient whose wife has been taken for operation, and he's cranky now and whatever. So you have 2 minutes to read the stem, and then you enter. You have 8 minutes to discuss. So if he's angry, you have to act accordingly. So some people are not very familiar with the situation, and it's your communication is your little bit of basic knowledge and these kind of situation based things, and you have to pass 9 of 16 stations. So
Okay.
sometimes it can be tricky, sometimes you can pass even without studying, so it's totally luck basis. Yeah.
And so I think what many people do is that they go through the PLAB pathway, that is they take like PLAB and then they come to Australia. So how does that work?
So there's a competent authority pathway. If you are working in UK for 1 year after clearing PLAB, you can shift to Australia without any exams. So that's a very good option if you are working in UK. But if you are starting your journey from India, then getting a job in UK is also very difficult.
Yes.
And you are wasting 2 to 3 years to get into UK, and then 1 year in UK, then shifting your country, because it's a difficult thing to do. So if you are starting from scratch, I would recommend to start directly go for Australia.
Okay.
Why to struggle UK and then deroute?
Makes sense. Yeah.
So okay, so my next question to you is, for Australia, the total expense from 0 to Australia is around $16,000 to $18,000. Earlier it used to be like $14,000, but now they are changing the AMC to face to face, so the flight cost and visa and everything, so it's a bit more expensive. But if we talk in Indian rupees, less than 10 lakh rupees for whole process.
Oh,
Okay.
that is good.
Including travel to Australia for AMC too. What about US?
So
Yeah.
US,
Because in US, I was doing some research, it's like 40 to 50. I'm not very sure. Like
no, so there's a huge range. Like there are absolute essentials that you will have to pay for, and then the rotations are something that can vary widely. Essentials that you need are like the exams and certifications. That will be around, all the exams and certifications will come around like $5,000. And then when you apply for residency, that will be another, like, because you will apply to a lot of places, it will come around to another $5,000-6,000. So these $10,000 to $12,000 are confirmed. You cannot cut back on them. Now, when you come for
that's US dollar.
yes, US dollars. When you come for rotations, the cheapest way you can do it is you come to US once, and then you find 3 or 4 free observerships. You stay there for 3 or 4 months and then come back. So in that case, the flight and the accommodation and everything will cost around $6,000 for 3 to 4 months. That is the cheapest you can do. But there are many places that offer paid rotations, like there are agencies and everything. So these paid rotations can range anywhere from like $1,000 per month to $5,000-6,000 per month. But on an average, they will charge like $3,000 to $4,000. So if you do 3 months, directly $10,000 to $12,000 will get added. So that
The range is really wide depending upon what you do.
Let's not confuse our viewers now, because I was talking in Australian dollars and you're talking in
Yes.
US dollars.
Yeah.
Let's give them a range
Indian
between
rupees.
Indian rupees.
So
like Indian rupees. So minimum is like how much?
minimum it would cost
Okay.
around like, no, I think we can say roughly. It would minimum it would cost 15 lakh
Roughly,
rupees.
yeah.
Yes, roughly 15 lakh rupees, and maximum it can go up to 35-40 lakh rupees.
And average, as per my data, what I analyzed earlier. So on an average, like you are going through that route, it costs around 30 to 40 lakhs for one person.
On an average, it would be 20-25 lakhs. 25 lakhs is fair.
Fair enough.